In what seemed like an attempt to respond to serious suspicions that the government bought an emergency drug suspected to be fake, Health Permanent Secretary Dr. Kenneth Malama told journalists at a workshop in Kafue District that it is normal and good practice to recall a batch of medicines deemed suspicious, as failure to do so may see persons like him being fired.
You check UK, America, Canada, everywhere. Incidents of medicines which should not go to the public or within the public and they are found and withdrawn, it's common. If there is a country where there are no reports at all, there is a problem. In the pharmaceutical industry, it's normal that in the quality assurance mechanisms, you should be able to pick any suspicion, quarantine it, and expose it to further analysis. So when you hear of a story or an incident where we've recorded some medicine, that's good practice. Failure to recall a product, we should be fired, all of us. We are incompetent because it's against the good tenets of governance in the pharmaceutical industry.
He admits that it would be irresponsible to give Zambians drugs that are suspicious or have not gone through necessary checks and balances.
There is no single country where each tablet passes through the quality assurance. This workshop is going to tell you how it is done. That's why when you hear us talking of a batch number, it means that consignment in that batch has gone through that processes. But there's also a possibility that something wrong can occur in the process.
It must be noted that the suspicious adrenaline had batch numbers EAZNL001 and EAZNL002, an indication that they passed through quality assurance processes. These drugs were already being administered to patients even as late as July 2019, despite a recall having been made on 10th May 2019. Some patients that were administered with this drug could not see any changes, a situation that puzzled doctors who knew its strength. The question remaining unanswered is, did government spend $53,964 on a fake drug? Dr. Malama could not give a comment on the specific matter, but assured that the ministry will respond in due course. Mark Pekumwenda, Prime TV News, Lusaka.